The Nile College is a medical school. As I said, it's a private medical school established is located in Khartoum. Higher education has its role to play in inclusive national growth, and this is well known. The presentation aims at exploring the potential contribution of a growing private medical institution, which is the Nile College in Khartoum, to national development. And the experience of the national college revolves around the holistic philosophy, the extensive experience of its founders, and the dedication of highly selected staff. In fact, in Sudan, there is a phenomenon. The majority of medical schools are in the private sector are actually owned by health professionals, medical professionals who invested in this. And Nile College is one of them. Top figures are Professor Mohamed Yousif Sukkar. I guess some of you might know him. He's a renowned physiologist and medical educator. And Professor Zain Al-Abdin Karrar is a renowned pediatrician. This is the building for those who visited, who know Khartoum. It's in east. It's in the area east of Khartoum, after the bridge, and they have this building for the and premises for the school. Since it was launched in 2008, around 1,800 students are admitted to the programs that are functioning within this school: medicine, pharmacy, dentistry, medical laboratory science, nursing, computer information systems, business administration, and accounting. That's mainly the sort of programs usually involved in private medical schools in Sudan. They got like 178 staff, of which 70% are working full time. Then this is some of the philosophy. They look at education as a goal in itself that leads to personal development and improvement of the quality of the life of individuals. They are family and community oriented, as will be shown in the presentation. The school builds on the old traditions, ideals, and integrity and excellence, relevance, as well as innovations. They have a vision to contribute to the national socio-economic development through promotion of service, education, and research. As I mentioned, the Nile College is, in a sense, community-oriented, and that will be shown later in their curriculum. And their mission centers around quality management. These are some of their premises, the laboratories, and the clinical teaching. The curriculum in the Nile College is an outcome-based curriculum based on integrated modules with both community, hospital-based learning experiences. So it's a rather the modern type of medical curricula, as opposed to the classical curricula that we see in established universities in Sudan. This is all about the curricula and the areas that are emphasized in the curriculum, and the teaching methods. In fact, the Nile College implies a blended teaching methodology, and that's because Professor Sukkar and others who are deeply rooted in medical education are trying to promote this new model of teaching. They also emphasize student research projects, and this is a very important dimension which we do not see much in Sudan because of issues related to capacity and funding. So this is all about their methods of teaching and learning and some of the activities. Also, they emphasize and use health centers in Sudan as training sites, hand in hand with hospitals. These are some of the activities of the Nile College students in health centers and outreach services. So some of the activities and voluntary work of students in collaboration with some of the NGOs, and that's an important dimension of the contribution of the Nile College as a medical school. This is very common in Sudan. In addition, due to its potential, the Nile College is contributing in supporting other medical schools in Sudan, in particular in different states of Sudan. And this is an example where a curriculum development workshop was organized for University of Dongola, which is in northern part of Sudan and hosted by the Nile College. Their system of assessment for student assessment is a continuous system based on attendance, assignments, and then formative and summative ways of assessment. By the way, there are a number of foreign students in particular in all private medical schools in Sudan, but in particular in this college, there is a good number of candidates from Nigeria and from some other few countries. The school is oriented towards quality assurance strategies in terms of the governance and recruitment of qualified staff, providing training opportunities for its staff, and then the IT infrastructure they have, and in addition, the community services they are providing, and also planning and provision of teaching and learning programs and the learning environment, and they are trying through different measures to ensure quality of the medical education and quality of the products from this medical school. Probably what is important is that they are currently involved in the accreditation system, which was set by the Sudan Medical Council. And this is one of the events in the Nile College where they embarked on a self-study for the medical school. And self-study is a prerequisite and a very important step for accreditation, where the medical school analyzes its strengths, weaknesses, opportunities, and risks, and then prepare a report as a primer for accreditation, which is led in Sudan by the Sudan Medical Council. In conclusion, the philosophy, the vision, and mission of the Nile College are translated into its programs, its teaching and learning strategies, its community outreach services, its focus on quality and accreditation for medical education. As I mentioned, is a growing private medical school or science that has established a robust learning system, and it's contributing to the socio-economic development in the country. I hope that I managed to reflect a bit on the great efforts that are being exerted by this medical school. But for sure, if Dr. Sumaia could make it here, then that could have been better. Thank you very much.